House Institute's always been on the forefront of hearing science, pioneering first in human studies. First ABI, first cochlear implant, first digital hearing aid, and we're continuing that work today. We're now working on new treatment options for NF2. We're working on new treatment options for sensory neural hearing loss, looking at new treatment options or diagnostic tools for diagnosing ear disease.
I am personally very excited about an ongoing trial that we're doing with the House Institute Foundation. It's a prospective study. It's looking at many years patients who continue to be symptomatic despite the treatment we're doing for them. So we're actually testing a medication that's well known, but we're testing it as a placebo control trial. We're looking if we can help our patients with their dizziness.
I've also been doing some work in the histopathology lab at UCLA, which has really added a great dimension to understanding certain disease processes in the ears, particularly in otosclerosis. So we have some interesting papers coming out on that. In terms of education, last year we instituted the first House Institute Facial Nerve Conference. So at this multidisciplinary conference, which happens every couple months, we discuss patients with specific types of facial nerve issues. So it's been really gratifying to hear specialists all around the country really talk about our patients and help us with planning therapeutics for them.
I'm particularly interested in the NF2 Center. Neurofibromatosis type 2 is a devastating disease, usually affecting or often affecting young patients. We've had a long experience with that, and the Auditory brainstem implant, which restores some hearing for these people who would otherwise be totally deaf, has been a project of mine for a long time. And we're excited about having a center developed to support these people.
Currently, I'm working on collecting more data for cochlear implant user outcomes so that we can better see where trends are heading and how we can help patients in the future.
House Institute has another program called the Hearing Science Accelerator. This project is identifying different types of hearing diseases and trying to figure out, by bringing professionals, scientists, researchers from around the country and around the world together, to actually develop short-term, medium-term, and long-term research plans for each of these new disease entities so we can really get to the focus of curing hearing loss. House Institute's goal is that no patient should ever have to suffer from deafness or hearing loss. We're continuing that work today. Join us and please give to help us achieve our goals.